Swadikap, good afternoon once again. Today is Sunday, the 30th of May, 2021, and this is the English language summary of the CCSA. So just now, Dr. Apisamai, in the Thai version, spoke in length about one particular issue, which is about the migrant labor construction campsites, particularly in the Bangkok area, and I'll recap that for you momentarily. So first of all, I'll start with the numbers that we have recorded for today. For today, we have new recoveries at 2,933 persons, 2,933 persons who have recovered. Now, the new confirmed case, we have 4,528, as you can see on screen right now. In that number, there are 2,599 cases of local transmission, 27 cases from overseas infection, and 1,902 from within the penitentiaries. We have 24 new fatalities to report, unfortunately. The cumulative number of deaths, fatalities around the country since the beginning is 1,012. Now, for persons who are still in active cases or still being treated, we have 48,051, so slightly over 48,000 people who are still active currently being treated in the different medical facilities in Thailand. And out of this number, we have actually just a small number, which is 389 of those who are still on ventilators. Those under treatment and still on ventilators. And this is cumulative. So just some observations from the presentation just now. Firstly, the provincial tally that we have for you each day. It's been many weeks now that Bangkok has been topping that list in terms of having the highest number of persons infected. As number one, for example, today in Bangkok, it was 754. Number two, for today, we actually have a province which is not actually in the vicinity of Bangkok. Number two, we have Pitbury Province. Pitbury Province. The remaining on the list of top provinces that are affected by COVID currently in Thailand are mostly provinces which are in the surrounding areas of Bangkok, and including Chonburi as well. We have also a high prevalence, high number of people being infected, positive with COVID in the prisons and penitentiaries of Thailand. Now, Dr. Apisamai talked just now in length about the migrant worker construction campsites. So talk a little bit about that first. In the beginning, first, the Bangkok metropolitan area is a very diverse, has a very diverse population, of course, multi-national. So we have non-Thai nationals being infected with COVID as well. Nevertheless, the active case finding missions continue in Bangkok, particularly in wet markets and especially in construction worker campsites. Now, there are around 409 total construction campsites around Bangkok, which are operated by approximately 134 construction companies. These are the construction companies that have registered officially with the authorities. Now, all of these districts have campsites. So meaning that in Bangkok, all the districts in Bangkok have construction going on, of course, and there are construction campsites in all districts. In one district, for example, there are up to 20 construction campsites. So you can imagine that in one district, the number of construction going on, of course, because of the progress, because of the infrastructure needs, business needs, there's construction going on all the time. And in one particular district, just as an example, there are 20 construction worker campsites. In one construction campsite, possibly the highest number might be around having 1,000 plus, over 1,000 construction workers. So this points to the importance that construction campsites have in our mission to contain the virus. So in this regard, the district chiefs, the directors of each district of Bangkok, have been ordered to meet with construction companies, as well as to make site visits into the construction camps, as well as the Department of Urban Planning, Town and Country Planning, or Urban Planning, have been in contact with all of these companies as well in order to talk to them about the important measures that they have to maintain because of the risk that construction campsites have with regard to COVID. Now, the plan is that from the 1st to the 10th of June, there will be more on-site inspection of campsites in the different districts of Bangkok. Up to, in those 10 days on the first weeks of June, up to 30 campsites will be inspected in terms of the environmental standards, in terms of the sanitation measures, and of course also in terms of collecting the saliva sample of people there as well. Now, just as a footnote that before these missions this month and next month regarding the construction worker campsites, 2 or 3 months ago in February, actually since the 13th of February, there had been the announcement about calling for illegal migrant workers to come forward and register and become legal, so to speak, without any repercussions. Now, up to 416,000 illegal migrant workers have come forward to register with the government in that scheme already. Now, it's very important because when they register with the government, their illegal status in terms of not having any insurance or social benefits, or in terms of the COVID prevention measures, that would be taken care of. But there remains around 200,000. There remains around 200,000 illegal migrant workers who have not registered in that scheme yet. So the CCSA has asked for the cooperation of employers or those employing illegal migrant workers to bring in the staff in order to be registered and to enter into the legal system, which will also include many social security benefits such as health insurance as well. So that's very important, and that's going on. But over 400,000 have been converted, so to speak, into legal, and 200,000 still remain. And that's very important for us because of the COVID risk for all, regardless of their status. Now, just some additional information about the Prime Minister reaffirming the nationwide vaccine rollout. The Prime Minister giving reassurances lately that we're doing our utmost to manage the distribution of vaccine supplies throughout the country in accordance with the rollout plan, with priorities given to those most in need of inoculation. Now, several groups urgently need, including those in the medical profession, frontline workers over the age of 60, and other epidemiologically vulnerable groups. The first phase will therefore seek to inoculate these said groups as a matter of urgency. And of course, as we've always been talking about, the 7th of June will be the official mass vaccination rollout in Thailand. For inoculation of people with disabilities, the Health Ministry has started to provide vaccination for those in vulnerable groups in Thailand. I think that's very important. At the Sirinthorn National Medical Rehabilitation Institute in Untitled Province. So up to 500 people, including those who are visually impaired, those over 60, those with underlying health conditions, along with their caretakers, are slated to be inoculated in this pilot phase for people with disabilities. So there are those coming, a particular number of those coming per day will be asked to receive the vaccination at the site until the inoculation target is reached. The Department of Mental Health is also in the process of inoculating people with autism, with Down syndrome, ADD, attention deficit disorder, as well as their family members or caretakers who live in the same residence. And this process began on Saturday, yesterday. At this early stage, only eligible people belonging to these groups that I've mentioned, residing in various provinces over the age of 18 are qualified for this scheme. The Health Ministry will soon extend the program to encompass people with other forms of disabilities who live in other provinces to ensure that vulnerable groups are included in the inoculation program. So for those with disability, it's a pilot program first in provinces such as Bangkok, Nonthaburi, Samut Prakan, and Pathum Thani. So this is just a pilot program, and this will be extended nationwide. Just one issue about the Thai variant misnomer, that the Thai health experts have pointed out that the so-called variant, Thai variant, reported by the Public Health England this week, did not actually come from Thailand, as the strain has not been detected in local transmissions anywhere in the country. So Dr. Wasan Chantratit, the head of Mahidol University's Center for Medical Genomics, explained recently in one of the Thai language programs that Thailand had found the C36.3 strain in a 33-year-old man on his return to Thailand in January. The man recovered from C36.3 variant the man recovered, and the variant had been eliminated from Thailand. And meanwhile, the CCSA experts had said that the particular details remain unclear, as the Public Health England is still investigating the matter and carrying out laboratory tests on this new variant. And according to the Department of Medical Sciences, a preliminary check has found that the new strain was brought into Thailand by a traveler who was quarantined after arrival. So the term country XX variant, for all intents and purposes, is therefore not a good way to address a variant, as I mentioned yesterday. And the term Thai variant in particular is not accurate and is a misnomer. So yesterday I had mentioned that the best way to talk about variants, any variant around the world, is a variant. The best way to refer to it actually is a variant first found in XXX country. And I recapped about that yesterday, but particularly for Thailand, for all intents and purposes, this is not accurate and is a misnomer. So thank you very much for your attention. I hope you have a pleasant rest of the weekend, and we'll see you again next week. สวัสดีครับ
ครับขอบคุณนะครับท่านณัฐพัฒน์